Hi everyone, it's 3:57 p.m. on the 3rd of June, 2011. I can't believe it's already June. 2011's gone by so fast, but anyways, the other day when I filmed the What It's Like to Have Chest Surgery video, I actually wrote down some tips as well, and I didn't want to make that other video too long. It actually ended up being longer than I intended, but I decided to make the tips into a separate video, so here it goes. The first tip, even though it seems really simple, write down any questions or concerns or just really anything, even if it sounds silly. Even if you're embarrassed, like the sex thing, you know, can you have sex? Write it down. A lot of times you'll get to the office or you'll have something you want to ask and you forget when you get there, and you just want to make sure you kind of have all the loose ends tied up and that you go in there with kind of a clear mind and really knowing what's going to happen, just so you feel good and confident. The second one is distraction. I know it seems kind of silly, but don't forget to bring books, DVDs, books on tape, your laptop. You will be so bored, you can't move much, you'll need something to distract you. Troy and I actually got a puzzle, and we did it in our hotel room. You know, we were holed up in a hotel room in December in Baltimore, and so it also helped us not move around too much. So we did a puzzle, and we ended up giving it to Dr. Fisher as a present. We got it framed, and it was a really nice thing. Remember to bring things to keep you busy. DVDs, Netflix is especially good, so yeah, don't forget distraction. The third one, bring straws, might sound really simple, maybe even simpler than the first two, but it's on all these surgery lists I used to look at, you know, for like what to bring and stuff, and I almost didn't bring it, but then someone sent me a care package for my surgery, and all these little random things that I think about, including maxi pads. You can actually stuff maxi pads in your binder, your surgery binder and stuff, to kind of catch the nipple leakage and help stuff it. The one side of the pad has adhesive, so it'll stick to your binder, and then you put the soft part against you. So that's a little write-up thing. But bring straws. You won't be able to drink like this, so you'll do this, and you'll drink from the straw. So don't overlook straws. It's simple, but you'll be out going to Walmart at midnight getting straws because this will hurt so badly, so bring straws. Number 4 is pack sore throat lozenges. This might seem a little odd, but as I mentioned in my last video, you'll be intubated, so sometimes having that tube in there for several hours can cause a sore throat in the days following surgery. So it's not a big problem if you forget them, but maybe just pack some sore throat drops so you have something to kind of soothe your throat. Tea is good too, so that works as well. Number 5, purchase laxatives. Okay, this one you don't want to overlook. Anesthesia will back you up. You will not feel good. You will be in pain and recovering, and you'll be backed up. It's not pleasant. Bring them. That can also not be pleasant, taking laxatives, but I'm pretty sure most surgeons include that on their list, but don't forget the laxatives. Number 6, pack flies. This is actually something you can do before surgery, like a year, 6 months, years before surgery, whatever. If you have a gym at the apartment you live at or wherever, or you belong to a gym, or even just with weights at home or whatever, do this kind of exercise and it will help develop these muscles here. That's why my scars have such a good shape. You know, if they can have good shape, you could say that. But Dr. Fisher was very easily able to find my pec muscles because I had done a lot of working out beforehand. Afterwards, I didn't really keep it up. That's why the scars kind of look, you know, like they're pecs, because it is actually my pec line. So that's definitely something you could be doing in advance. Even if surgery is years off, you could have awesome pec lines. The surgeon will know exactly where to cut and it'll look very natural. So that's cool. One thing I didn't mention in yesterday's video were drains. You'll have drains. They will be inside you, inside your chest, you know, like here, down here, wherever. I had them up here because I'm smaller. They will go in your chest, and having them removed can be very painful because they pass through nerves and through sensitive parts. They described it to me as a burning sensation. This was the one part of surgery I was really worried about. Some guys have a lot of problem with this. They said it was the worst part of surgery. It was excruciating. They almost passed out, whatever. The pain was so hard when they got them pulled out. But then conversely, other guys have said that they didn't even feel it. I actually was in the latter category. I did not feel the first one. The second one was more like I felt it moving through me. But other than that, I was fine. I had got advice from a friend to take the pain medicine that they prescribe you, to take one an hour before you go get them removed. You know, your body's kind of ready for that, and then it could dampen the pain that you could feel. So that definitely helped, and had no pain. So that was very nice. I could just, with the second one, I remember she did it, and then I was like, oh, I'm so worried. She goes, I already did one. And then the second one, I just felt her pulling it, and then I felt it coming out, or, moving through my chest, which was kind of an odd sensation to have something moving against here, like it's like flat bone, on top of it. It was just kind of gross, but whatever. You'll find floaties and chunks in the drains too, which can be gross too, so I don't know. Surgery, you're not at your best because you can't bathe for a week either, so hopefully you have someone to help you wash your hair in your sink and kind of give you sponge baths, because it's really difficult. One more thing I wanted to address was stopping tea before surgery. My surgeon, Dr. Fisher, did not require me to stop tea, but now she does. It's a new thing. Some doctors believe tea interferes with healing and maybe causes some blood clotting. I did have a hematoma. I had a complication with my surgery. I had a hematoma that ended up being calcified in my chest. So I did have to go back for a revision, get it removed. We're not sure if that was because I was on tea beforehand. I know going off tea can cause a lot of emotional and physical side effects we do not want. So talk to your surgeon. It all really depends on the surgeon. Either way, I don't think there's any really medical evidence to back it up. I just think they're being safe. I guess, better be safe than sorry, but hope that helps. Thanks for watching, and take care, guys. Have a great weekend. Peace.